Doctors at Riverside Hospital pulling off something pretty amazing when a Columbus grandmother comes into the emergency room. She had cut her own hand off. 10 TV's Ashley Berry explained what happened and how those doctors were able to reattach it. Gotta warn you though, some of the photos are really pretty shocking.
I was trying to hold the board with this hand. Not a good idea, and bring it down this way.
It's a remarkable story of survival and recovery. 64-year-old Pat Marvin spoke with us from her hospital bed just 2 days after she literally sawed off her own hand just above the wrist during a home improvement project gone terribly wrong. Take a look at these x-rays. This is what doctors at Riverside Hospital had to work with. And amazingly, this is what they were able to accomplish.
I just thought, I'd just have a elbow left, and I was surprised when I woke up and I had my hand.
Not only has Marvin's hand been reattached, but also the nerves, arteries, and veins are, for the most part, fully functional.
I can wiggle it now. Look at, see that? And that wasn't even attached.
The x-rays are hard enough to look at, but just imagine it being your own arm. Marvin says when it happened, she didn't really feel any pain, but then looked down and saw her hand lying on the floor. She almost couldn't believe it, but then looked at her left arm and noticed that her sweatshirt was wrapped around the injury. She ran outside and started screaming for help, and credits a passing stranger in that makeshift tourniquet that the power saw created for her life and sense of humor.
And my doctor likes for me to show my new wave.
In Columbus, Ashley Berry, 10 TV News.
Really amazing, huh? Marvin now has steel rods in her arm. She'll have to spend the next 2 years probably in physical therapy. She is hoping that the stranger that ran to her aid will come back to her home so she can thank him.